Assalamualaikum, dear brothers and sisters. Dr. Mushtaq Ahmad, Orakzai, advanced laparoscopic and bariatric surgeon. As you know that the holy month of Ramadan, and all those patients which were operated previously and for bariatric surgery, and we did bariatric surgery. Some advices we want to give them. First of all, as you know that the capacity of stomach is very low after bariatric surgery. The pouch is very small, and we need nutrition and fluid, at least 1.5 to 2 liter fluid per day. So as you know that after iftar, everyone try to eat more because they are thirsty, they are very hungry. Some tips I want to share with you is that first of all, try to take small amount of water with dates or with dry fruits or some other thing that contain less sugar. And then after performing prayer, do exercise at least 10 to 15 minutes, go around here and there, and divide your meal into 4 parts. First is iftar, and the other is first snack, second snack, third snack, and then suhoor. That is sahri. So first of all, I want to share you after iftari, avoid sweet confectionaries, bakery items that contain a large amount of carbohydrates and sugar, because it will create dumping syndrome. A patient will feel hypoglycemia. A patient hands, there will be tremors, there will be sweating, a patient feel uncomfortable. So try to avoid sugar items containing high volume of sugar. And the other thing is that avoid to take solid with liquid. For example, after iftari, you take solid food along with water. So this is not good. It produces small capacity for the meal. The other thing is that it will increase dumping syndrome. The other thing is that with iftari you can take yogurt that contains less sugar, and skim milk that contains less fats, and soup that's warm. It will be better for the patients, or warm water will be also better for the patients rather than cold water at sahri time. Try to wake up early for suhoor, for sahri, because if you have small time, if you have less time, so in less time eat more is not good for bariatric patients. Try to wake up at least 1 hour, 1.5 hours before the sahri time ends. So you will be able to take a lot of water along with some food, and try to take food that contains large amount of proteins especially, and low carbohydrates, and avoid fats, because fats will increase movements of the intestine, and it can cause diarrhea and dehydrations. Thank you very much, and any question you want to ask, you can send messages through messengers, WhatsApp group, and Facebook as well. Thank you.